Okay, and what's next?
I'm going to be getting the vital signs on my patient as part of my assessment.
Do you have everything you need?
Yes, I think so. Digital thermometer, blood pressure cuff.
Is it the right size for your patient?
Yes, and of course, a stethoscope.
Okay, just a couple of things before we see your patient. Remember, when you're taking an oral temperature, you need to assess whether or not your patient can follow directions.
If not, they could get hurt, right? Like if the patient bites down on the thermometer. So if they can't, then I take their temp another way.
Right. An oral measurement is also contraindicated in patients with diseases of the oral cavity.
And for those who've had surgery of the nose or mouth.
Right. What's next?
Pulse assessment, then respiratory rate. And I shouldn't let the patient know I'm counting respirations because it might change the way they're breathing.
Very good. Any questions on blood pressure?
Not really. Make sure the patient is rested for at least 5 minutes before and hasn't had any caffeine or nicotine in the last half hour. It sometimes takes me a bit to find the brachial artery, but I get it.
And what do you assess for?
I don't want to use the arm with an intravenous infusion or a cast.
Or the side where there's been breast or axilla surgery. You should also not use the extremity with an arteriovenous shunt or an injured or diseased limb.
Oh, now I remember that. We talked about it in class.
Very good, Rose. Sounds like you have every reason to be confident taking these vital signs. Ready?
Let's do it.
Okay.
Hi, Mrs. Hodge. I'm Rose. I'm a student nurse, and I'm going to take care of you today. This is Miss Varga. She's my nursing instructor. How are you doing today?
Fine.
I'm here to measure your vital signs, if that's okay with you.
Yes, of course.
Can I have a look at your wristband?
Sure.
Thank you. And your full name?
Irene Hodge,
And your birthday?
December 6th, 1934.
Great, thanks. Can you hold a thermometer under your tongue?
I would hope so.
Anything to eat or drink in the last half hour?
No.
Gum? Smoking?
Heavens, no.
Very good, Rose. You remembered to ask about these things that can directly impact the vital signs. Remember, if Mrs. Hodge would have answered yes to any of these questions, you'd wait 30 minutes before taking her temperature.
Looks like the thermometer's ready to go.
Remember the cover. Make sure you hear it click into place.
Thanks. There. Open up, please, and I'll just place this right under your tongue. And if you could close your lips around the probe, great.
And remember to keep holding the thermometer. So why is it important to have the probe rest in the posterior sublingual pocket?
Because it's in contact with blood vessels that are close to the surface, and we get a more accurate reading of Mrs. Hodge's temperature.
Very good.
And there we are. I'll take that out.
How is it?
Great, 98.7.
Wow. Glad it's not high.
Don't worry. If it was abnormal, Rose would know what to do.
Report it to the primary care provider immediately.
Now Rose is going to take your pulse.
Is this where you touch my neck like on TV?
No, I'll be taking your radial pulse, and that's on your wrist. I'll count for 30 seconds and multiply by 2, right?
Very good. And remember, when taking a pulse, your fingers should be flat against the patient's skin. And if the pulse is unusual in any way, palpate and count the pulse for 1 minute.
Great, thank you. Pulse rate, amplitude, rhythm, everything's great. I also checked her respiratory rate by counting the number of respirations for 30 seconds and multiplying that number by 2 to calculate her respiratory rate per minute.
Wow, you are tricky.
Well, it's not to be tricky. We try to avoid letting patients know that we're counting respirations because they might unconsciously change the way they're breathing.
Impressive.
Rose, did you assess the patient for respiratory distress, retractions, nasal flaring, grunting?
Yes, regular rhythm and depth. And if the respirations are unusual in any way, then I would count the respirations for at least a full minute.
All right, excellent.
Okay, now we'll take your blood pressure. Okay, I just want you to get comfortable and put your arm like so. Good. How's that feel?
Fine.
Okay, I'm putting her arm on the pillow to make sure her forearm is supported at the level of her heart. Your back's supported. Good. Are your legs crossed?
At the ankles they are. I always do that, but I can uncross them.
Thank you. Now I'm going to slide up your sleeve so I can wrap this cuff around your arm.
You'll want to palpate the location of the brachial artery.
Right. Okay. I'll put the center of the cuff about midway on the arm, so the lower edge is about 1 to 2 inches above the inner aspect of the elbow. And I'll line up the artery marking on the cuff with the brachial artery.
Right.
Okay, and let's see. The needle is within the 0 mark. Good. Now, I'm going to estimate your systolic pressure, which will help make sure I get an accurate reading.
That's good. Estimating the systolic pressure prevents inaccurate readings if there's a pause in the auscultated sounds.
Okay, now I'm going to inflate the cuff. It's going to feel a little tight.
That's okay. I had 3 children. I can certainly handle this.
Note the point on the gauge where the pulse disappears.
Got it. The pulse disappeared at 110, so I add 30 to it, which means I'll inflate the cuff to 140 when I take her blood pressure after waiting a minute or so, right?
Right. Now remember, you'll place the stethoscope firmly, but with as little pressure as you can.
And don't touch the clothes or the cuff.
Right. And note the point on the gauge when you hear the first faint, clear sound that slowly increases in intensity, and the point in which the sound completely disappears.
That'll be the systolic and diastolic pressures, right?
Right.
Okay. Okay. All done, Mrs. Hodge. Your blood pressure is 112/64. Great.
Now, if you're suspicious of a reading, wait at least 1 minute before you try it again. Remember, if you want to recheck the pressure reading, do not reinflate the cuff once the air is being released. Wait 1 minute and repeat the measurement.
That was easy.
Can we do anything for you before we leave?
No, I think I'm all right.
Okay. We'll be back shortly to check on you. I'll take that. Thank you.
Thank you.
Here we are. And then you've got the, okay. Thank you.